Okay, so here, like I said, if you do this initial part here is where you're just starting to put traction on the sciatic nerve. So you shouldn't get too much into that area. Then when you start getting into this range here, that's where you're really going to be feeling the sciatic nerve tension. If it doesn't start till you get farther up like that, then that's probably something else. So when you're doing the straight leg raise and you ask the patient, does that reproduce anything? Do you feel any pain with that? And they say yes. And what's the next thing you want to know? What's that? The quality of the pain, yeah, but what else? Yeah. Does it make a difference if it's in the lower back as if it's down the leg? Yeah. And then also you want to like to see what's like the quality of the pain. If they just say, yeah, my muscles are tight back here. Okay? And then they also had the same thing when you bent forward like this. They say, yeah, pull right here. So what would you say about that? It's the same thing on both sides and they do most tight. It's just they have tight hamstrings. Just because they have pain down the back of the thigh and the knee doesn't mean they've got nerve wriggle. Right? Is there any numbness? Or more specifically, when you want to say, does that reduce the pain that you have that you're telling me about because you're getting this pain down your leg? So does that reproduce the pain that of your symptoms? Not just, well, yeah, it pulls on my leg. It might be on both sides. It might just be the muscle tightness. Like so here you have the piriformis test. So right there is where the piriformis muscle is. So basically what we're doing is we're stretching that muscle. Okay? When we talk about, it's almost like a tunnel syndrome, like a nerve tunnel problem. Okay? How do you compress a nerve in the IVF? Either you narrow the opening, or you tap on the nerve, you stretch on it. What we're doing here basically is that sciatic nerve, a lot of times, in some people, it comes out through the piriformis, or if there's some type of irritation of the sciatic nerve at the piriformis muscle, we're contracting that piriformis muscle, or stretching, or closing down when it's pinching the nerve where it's coming out. So basically what we're doing here is we're stretching that muscle. So here you can see it's done from the other side. Basically, now what I'm doing here is I'm holding on the sacrum. Because where is the piriformis attached? On the sacrum. So what you're doing is you're stabilizing the origin of the muscle and then stretching back here. Whereas I think in that other picture, they're stabilizing at the pelvis. So it's a little bit different if you stabilize there. And then the other thing is from this position here, when that piriformis muscle contracts, what's it going to do to the femur? In terms of rotation, what way does it rotate? If I do this, which way is my heel going to go? This way or that way? But the muscles back here are going to contract like this, right? Is that internal rotation or external rotation?
External.
Yeah, because I always look at the anterior part. So it's an external rotator of the hip. So what you could do is do resisted external rotation, internal rotation to contract that muscle. So you could hold over here and ask them to bring the foot down that way. That's not necessarily part of the test. Basically what they're doing is just stretching the muscle right there. Stretching it here. And there could be some pain in that muscle there. So that could just be cramping of the piriformis. But what you're looking for is the radiating pain. So pain coming down. You're looking for reproduction of the symptoms of the sciatic pain. All right, then here's that femoral nerve traction. So first you're putting the hip into flexion to kind of free it up there, and then you're bringing it back and stretching back like that. So now the hip is in extension, and now we're flexing the knee. So where are you looking for the symptoms? In the front, on this leg. If you feel it down there, then it's called the cross-femoral nerve retraction test. Same test, just symptoms in a different area. Okay. So what we can do is we can take a break at this point, and we'll come back at a quarter after. And then I'm going to start the video at about 10 after if anybody wants to watch it. I have the quizzes from last time. Is there anybody that didn't take the quiz on the forearm hand and wrist? Okay. So I'll put them out. You can look at them. I need to get them back so I can scan them. And I have this. I have the grades of your case studies, but I left the actual paper at the office if you want to look at your grade. But I'll have them for you next time. Is it? Is there anybody that's scheduled to do any lumbar tests or exercises today?
10 of us.
Okay.
What do you mean by sorta?
Well, he kind of like showed it already. And you know, I could never reproduce that. I'll get a great model.
You know,
I was just, there's no way I'd be able to top that demonstration, you know?
That was really fun too. It was 9 o'clock on a Friday night.
Oh, awesome.
We know how to have a good time here on staff.
I hope you guys went out. Like somebody go do this tonight.
No, now I feel cheap.
needles when you're doing your treatment, right? So then what we're going to do is talk about the bones and anatomy. We'll get into a little more detail and the different conditions. And I wonder if that's how they discovered acupuncture, right? We have porcupines in China. So you can see low back has been going on for a long time in history, right? Back to the times of the Egyptians. What kind of problem do you think that is there? Yeah, they call it sway back, right? Sway back goes way back, right? Into history. So there's different theories as to low back pain. I mean, obviously at some point in time, 80% of the people are going to have low back pain at one point or another. Most of the time it's not anything serious and it goes away, but sometimes it doesn't. So perhaps it's because a man started walking upright, men and women, right? We got to be politically correct here. So it could be poor mechanics in the workplace. Obviously, this is an example of good mechanics. And then people are not as active as they might have been in the past, right? Does anybody remember that there was a time when TVs didn't have remotes? Yeah. So, again, like we're saying, low back pain, a lot of times this is more mechanical low back pain where it's more, sometimes it can just be the joints that can radiate pain. A lot of times it's going to be central in the low back here. But as I mentioned before, you can have low back conditions that will radiate pain down into the leg, or in this case more specifically the thigh, where it's not necessarily a disc herniation. It can be facet joints, SI problems, things like that. They can radiate pain down into this area here. But when you're talking about down into here, then you're talking usually about neurological types of things, disc herniations, things like that.